I wanted to go home. And the minute I got home, I felt better. And I had somebody who was going to stay there with me, and I kept her around for about 30 minutes, and I told her to go away. I don't want anybody hovering and whatever, and I was in perfectly fine condition.
And you weren't 25 when you had the surgery?
No, I was 66. Yeah, I had just turned 66. Right, and I'd struggled with the weight, obviously, my entire life. So the weight came off just fine. I lost 110 pounds in the first year, and then it stopped dead.
We don't actually use that adjective.
Right. Stopped cold.
There you go.
Stopped cold. And so I went to Weight Watchers and got the next 30 pounds off that way. 10 of which I've just recently, in the last month, put on because they're fooling around with my thyroid medication because I got some osteoporosis. So, and I've had some glitches. I did have an ulcer 9 months out. I was compliant with everything. I did, I took the glutamine and the creatinine and the fiber. I did everything that the manual said to do, and I still got an ulcer. And actually, Nexium cured me. I had been taking Prilosec, but I had stopped taking the second pill. I was doing Pepto for 5.5 months, and I took the Tums and all of that, but I did get the upper ulcer. It was cured within a couple of weeks, and I haven't had any problems since with any of that.
So it's a good example. This is the thing we worry about, getting that ulcer. You can get that ulcer. You don't want that ulcer. And sometimes it'll happen even in the best of situations, but we do know things that generally protect against ulcers, and we know things that generally cause them. And you don't want to do the things that cause it, and you do want to do the things that protect against it.
Actually, Dr. Rutledge threatened to do a revision on me, and I ran to the gastroenterologist.
Right.
I said, no way,
well, in other words, God forbid, if her ulcer had not healed, we can always get out of the problem by revising the surgery. And when I recommended that to her for consideration, there was a click on the other end of the line. So
I was not buying that.
Right.
So that was, and it was cured, and I got the next 30 pounds off, and I've been basically stable for more than a year. Now, the lady who was talking about pain in her knee, I had a hip problem. I was limping before I came in for surgery. I couldn't exercise, I couldn't walk, I couldn't do any of those things. So a year and 4 months after the stomach surgery, I had my hip replaced. I have a titanium hip. And if you talk about pain medications, I always tell everybody going into everything, I can't take any aspirin or any aspirin-related products, and if you're going to give me pain medication, first of all, you have to give me electrolytes when I arrive at the hospital, because I had to give blood, they had to store blood for a month for me. So I told them that they had to replace the electrolytes in my arm the whole time I was there. They were doing surgery on me so that I wouldn't have the problem of passing out, because I knew that it was an issue. And then they gave me really good drugs for the pain. First-rate drugs. I had Vicodin for about a month. I took it morning and night, and I was worried about becoming addicted.
Yeah, possible.
But the doctor said, as long as you are in pain when you're taking it, it's not going to be a problem, and that turned out to be the case. Within a month, I was able to quit it completely, and by then I was also walking a mile.
Was this Vicodin orally?
Yes. Mm-hmm.
Well, I thought you can't do that orally.
Well, we don't like Vicodin because it has Tylenol in it, but again, it's just like we talked about it. If you take it, I would like the Vicodin without the Tylenol.
Well, maybe that's what I got. It was called hydrocodone.
Hydrocodone is Vicodin without the Tylenol.
That's what I got.
Yeah.
Okay.
It said Vicodin in parentheses.
Hydrocodone is Lortab, isn't it?
Lortab is hydrocodone with Tylenol in it.
Right, and oxycodone has no Tylenol, right?
And hydrocodone has no Tylenol.
Oh.
Anyway, that's what I took.
And that's a good choice. So narcotics after the surgery, okay. But just not too long.
And much more fun. Anyway, so now I can walk 2 or 3 miles, no problem. I also exercise in the pool 5 days a week.
Now, how did the pain from your hip compare to your MGB?
I had no pain from my MGB.
I'm sorry?
I had no pain. Zero. Okay. Goose egg. And I've had mouth surgery since. I've had 4 implants put in about at the end of August. But one of the things, part of the reason that I've made sure that I got by here today, I was going to ask you about, is that I've got osteoporosis. And that I didn't know if there was a relation. I came here to ask if anybody else had that problem or if there was a relationship.
Let's talk about that. Yeah.
Okay.
Osteoporosis is a terrible problem in people throughout the United States and around the world, even though they haven't had my surgery.
Right.
So we need to start off with that.
Right.
And you also know the treatment, because you watch TV every night. The treatment is
Calcium.
calcium, except that's wrong. Because they've done a big study and they found that they gave women a lot of calcium, it didn't help that much. And think about it, our United States, we're up to our aspirations in calcium. I mean, we have a lot of calcium in our diet
Right.
compared to most other countries, right? Yet we still have a very high rate of osteoporosis. So the new hot research is that we have lots of inadequate vitamin D in our patients. So has your vitamin D level been measured?
They took it and it was low, and they put me on 50,000 units a day,
Yeah, there you go. Now
and
stop.
it went right back up.
Right. So the conundrum is we have lots of osteoporosis, we have got lots of calcium, we've been giving lots of extra calcium to people, and it really hasn't helped their osteoporosis that much. Big research study recently showed that extra calcium didn't help that much. The new thing is now vitamin D3 serum levels are easily available. Big studies show lots of us as normal Americans have low vitamin D, which is important in your bones. So now the new hot area of research is to give extra vitamin D. Now if you look on the back of your average multivitamin, it has about 400 units of vitamin D. The new research is saying that we should be taking 1,200 units of vitamin D, which would be 3 vitamins a day. And what did I recommend starting 10 years ago?
3 vitamins a day.
Sometimes you get lucky, I guess. Anyways, the high dose of vitamin D is very important. And another thing that's very important is to get your vitamin D levels measured. Plus, another paradoxical finding is, remember all the dermatologists told us never to go into the sun again. We should live in the dark and never see the sun because we all would get melanoma and die. Well, now the bone doctors are saying, no, we need to all get a minimum of 20 to 30 minutes of direct sunlight every day. Not that you should lay out on the beach and become a chicken wing,
Crispy fried.
No, don't want that. But sun is the most important part because vitamin D is actually not vitamin D is not vitamin D. There's a rose is a rose is a rose. Well, vitamin D in your tablets is not vitamin D, it's actually vitamin D. And what you really want is vitamin D 125, vitamin D, or vitamin D3. And conversion of vitamin D to D3 occurs in the skin, so some sun is very important. Plus, another very important finding about osteoporosis is if I put your leg in a cast, I could feed you calcium till the cows come home, and your bone will still tend to soften and get osteoporosis because you don't build bone unless you stress the bone. So you can eat calcium, you can take vitamin D, but unless you bang on the bones, which is exercise, particularly weight-bearing exercise, bones will tend to soften. And again, lots of us in America don't do that. We sit, like my job now, not building much bone today. So you want to think about stressing the bone as much as you can. You talked about walking, but also weightlifting. Not many of our patients can take up jogging, but you want to do things that use stress across the bone, plus the vitamin D are the critical new things that I know about in osteoporosis.